Hello guys, so welcome back to another important video in which we are going to talk about another important finding on pap smear that we usually get on, and there are certain indications of that when we have to go for further workup or management. So this finding is basically atypical glandular cells on pap smear, which is also known as AGCs. So, AGCs, what do we mean by AGCs? Basically, these are the glandular cells. We know that on cervix, from where we take the sampling of pap smear, we take basically this for cytological testing, we take the cell sample, and the cells are basically of squamous in type. But if we specifically get this finding of glandular cells on the pap smear, there are only certain indications in which we have to go for further endometrial sampling via the endometrial biopsy. We do not need to go for endometrial biopsy in each of the case in which we are getting these AGCs. And what are those specific indications? First of all, if we are getting these AGCs or glandular cells on pap smear in patient age equal to or more than 35 years, we have to go for endometrial sampling via the endometrial biopsy for further workup to look for any sort of endometrial hyperplasia or evidence of endometrial neoplasia, or if the patient is at high risk or at risk of endometrial hyperplasia, and the patient specifically who are at high risk for endometrial hyperplasia, we do not need to look for the age of the patient. If the patient are having the certain conditions, for example, they are extremely obese, they have the history of PCOS or the current PCOS, or they have the history of irregular menstruation due to anovulation. So in these cases, there is this state of, I would say, hyperestrogenemia or estrogenism. Hyperestrogenism. So that will eventually leads to what? Unregulated or continuous, I would say, endometrial proliferation. Right? So there are certain states that will eventually set on the continuous endometrial proliferation, and that will eventually increase the risk for endometrial hyperplasia, and these are those cases. So in this specific population, we have to go for further endometrial sampling via the endometrial biopsy, while in patients aged less than 35 years or who are simply the premenopausal women, and if we are getting the AGCs on them, then we do not have to go for anything, because in premenopausal women, if like within first 10 days of menstruation, if we are getting the results of AGCs, that this finding is completely benign, we do not have to go for any further evaluation. So guys, that's it for the today's video. Happy studying. I'll be back soon with another important video. Until then, bye bye.